Folks, it's inevitable if you spend enough time in this fantastic hobby, you're going to have to deal with fish disease. In the last couple years alone, I've had to deal with swim bladder issues with my mollies and other fish. I've had to pull an anchor worm out of my bristlenose pleco, did my first fish surgery, dealt with fin rot and fin melt with my beta several times, helped my father clear fungus off of his ram, and a new one. I bought some Black Phantom Tetras for my new 36-gallon bow front tank, and they have columnaris, so I'm dealing with that as well. Now, I'm not a veterinarian and certainly no expert on fish disease and medication, but in a series of videos, I'd like to give a very broad overview of my understanding and what's helped me. So coming up, Part 1, the first treatment, bacterial disease. Just as there are a lot of diseases out there that affect our fish, there are a lot of medications on the market for us to choose from, but how do we know what medication to use? How do we know what to buy, and how do we know how to help our fish? This is a very broad topic, so this video is intended to be a general overview, mostly for beginner to intermediate hobbyists. Let's talk about bacterial disease. Now, one of the things to know about bacterial disease is there are two types of bacteria that affect our fish, gram-negative and gram-positive. Now, most of our fish are affected by gram-negative. There are more gram-negative bacterial diseases in our tanks than gram-positive. Another important note, bacteria can be anaerobic, not needing oxygen, or aerobic. Now, Aeromonas, Pseudomonas, and Streptococcus are three of the most prevalent in our tanks. But what's important to note is there are medications designed specifically to combat gram-negative or gram-positive bacteria. Let's talk about some common gram-negative bacterial diseases in our tanks, fin rot or fin melt. Now, while it can be gram-negative or positive, it is usually gram-negative and can be combated with jungle fungus clear and Canaplex, that combination, triple sulfa, or Furan 2 and Canaplex, all medications designed for gram-negative bacteria. Now, if it's gram-positive, erythromycin will work, but if you try to use Melafix or Betafix, it won't work. It's not designed to combat advanced fin rot and advanced gram-negative bacterial diseases. Columnaris, I'm dealing with this now, mostly gram-negative. This is cotton wool disease, and this is a deadly disease, causes a necrosis of fins and cells. It can be combated with Furan 2 and Canaplex. It has to be that combination, or jungle fungus clear and Canaplex. In those combinations, you're using nitrofurazone and kanamycin, both very good at gram-negative diseases. You can also use methylene blue or potassium permanganate. But what's important to note about columnaris, it is aerobic. It needs oxygen to thrive. You'll find them in tanks that have good circulation and good oxygen content. Dropsy is the opposite, caused by Aeromonas bacteria, which is anaerobic. It does not need oxygen to thrive. So if you keep good tank aeration, that will help with treatment, providing an oxygen-rich environment. It is gram-negative, and it is a kidney disease causing fluid retention in the kidneys. Now, Canaplex has been proven effective in some cases against dropsy, as well as API's triple sulfa. Mardell's Maricin 2 has been proven effective in some cases. And remember, folks, everyone's case is different. So this is a general overview of medications and diseases. Now, with dropsy, you can also give a medicated bath, 1 teaspoon per 5 gallons of Canaplex. You can add methylene blue to that and 1 to 2 teaspoons of Epsom salt to try to get the swelling down. The active ingredient in Canaplex is kanamycin, which is internally absorbed by the fish. Hopefully that will help. A big one here, folks, intestinal bloating or swim bladder infection. This is gram-negative Aeromonas bacteria. And usually, when a fish eats decomposing food or decomposing organics, this is where the Aeromonas has a chance to infect the fish internally. Now, one thing we can do is use API Stresszyme or Fluval Biological Cleaner, both of which contain bacteria that help break down decomposing organics and sludge in the tank. So with a little preventative maintenance, we can help combat this disease before it gets advanced. Now, if it's more advanced, you can certainly try to give your fish an Epsom salt bath with methylene blue, and you can feed your fish peas if they are eating. They're high in fiber and they can help clean out your fish. It is a good practice to feed your fish peas at least once a week to help clean them out. Eye infections, folks, can be very serious. This is a gram-positive bacteria, usually caused by Streptococcus. It is very aggressive. You'll see this in pop-eye or cloudy eyes in your fish, and it can also cause dropsy. Now, good medications to combat this, erythromycin, a great gram-positive bacterial medication. You can also use Seachem's Neoplex. But if you were to try to use Furan 2 or triple sulfa to combat an eye infection, it won't work. Furan 2 and triple sulfa are designed to combat gram-negative bacteria, so we have to use a medication that will combat gram-positive bacteria. While this video is a very general overview, here's the point I'd like to drive home. There are different types of bacteria that affect our fish, gram-negative and gram-positive, but mostly our fish are affected by gram-negative bacteria. Bacteria can also be anaerobic or aerobic. If they are anaerobic, providing good circulation and aeration will help with treatment. Aeromonas, Pseudomonas, and Streptococcus are the bacteria most prevalent in our tanks, and most importantly, there are medications specifically designed to combat gram-negative or gram-positive bacteria. So if you can do your best to make a diagnosis, you'll know what type of medication to buy and whether you need medication that combats gram-negative or positive bacteria. The Den is on Instagram at dmichaelsfishden. Join me if you are so inclined. I'll have more videos coming up on fish disease to follow. Please like, comment, subscribe for future content, and as always, folks, thanks for watching.